Hello, everyone, and welcome to the lecture series of the University of Central Asia. Today, we have a very special guest. Dr. Tasnim Atatrah has worked for the World Health Organization since 2010 and is currently leading the emergency preparedness and implementation of the international health regulations in Central Asia. For the past 17 years, she has led emergency and public health response in Gaza, Syria, and Libya, and interventions in refugee camps in Palestine, Jordan, and Lebanon. Among her many degrees are Doctor of Medicine and Master of Public Health and Epidemiology. Prior to joining WHO, she worked with USAID and UNICEF. COVID-19 is an inescapable reality, and today's lecture by Dr. Atatrah goes beyond basic preventative measures. Never in recent history have families lived in such close proximity for long periods of time, and this has led to considerable emotional and mental health issues. After the lecture, there will be an opportunity to ask some questions. So please text your questions before the end of the lecture in the chat, in the question and answer box. So please join me in welcoming Dr. Tasnim Atatrah.
Assalamu alaikum to all colleagues, to all participants who are attending and watching us now. When I was approached to make this presentation or lecture, I was feeling honored and pleased to be part of the community, to be part of the community of the university, which is providing a leading example of how to support the community, not only as a lead in education, but also as a proactive institution to help the community. In this difficult time, one of the main challenges we are all facing is access to information and uncertainty, which makes us all worried and anxious. In this 1 hour, I will try to provide information in a simple approach. And if you allow me, I will be giving few slides which will help us to learn more about this crisis. After 6 months of this crisis and this pandemic, I want to start with providing an overview of the timeline. As yesterday, we passed 6 months after the first cases of pneumonia were reported from China. On the 13th of January, the first cases were confirmed outside China, where officials confirmed cases of COVID-19 in Thailand. On January 30th, WHO Director General, Dr. Tedros, declared the outbreak as a public health emergency of international concern in accordance with the international health regulations. On March 11th, the WHO made the assessment that COVID-19 can be characterized as a pandemic. And on March 18th, the first 3 cases of COVID-19 were reported in Kyrgyzstan. To provide an overview of the trends globally, up to yesterday, more than 10 million cases have been confirmed and more than 500 deaths were reported to WHO. To give more picture to how this is also going on in Central Asia, in Kazakhstan, where the first cases were reported on March 14, about 21,000 cases were reported and 188 deaths. In Uzbekistan, the first cases were reported on March 16, and up to date, more than 8,000 cases have been confirmed and more than 20 deaths. In Kyrgyzstan, the first cases were confirmed and reported on March 18, and up to date, more than 5,000 cases have been confirmed and about 57 deaths. And in Tajikistan, the first cases were confirmed and reported on May 1st, and up to date, more than 5,900 cases have been confirmed and more than 50 deaths. So in Central Asia in total, we are talking about more than 40,000 cases that have been reported. But what we know about coronavirus? Coronaviruses are a group of viruses belonging to the family of Coronaviridae that infect both animals and humans. Human coronaviruses can cause mild diseases similar to a common cold, while others cause more severe diseases. How can coronavirus spread? Human coronaviruses are usually spread through droplets and close personal, unprotected contact with an infected person, like through touching or shaking hands. And when we are asked, what are the symptoms? Signs are symptoms are typically respiratory symptoms and include fever, cough, shortness of breath, and other cold-like symptoms. The incubation period of COVID can be as long as 14 days in an average of 5 to 6 days. And we have been hearing a lot of the term contact. And a contact is defined as anyone with the following exposure to COVID-19 case from 2 days before to 14 days after the case's onset of illness. So the contact is being within 1 meter of a COVID case for more than 15 minutes, or a direct physical contact with a COVID case, or providing direct contact for a patient with COVID disease without using proper personal protective equipment, and other definition as indirect, as indicated by local risk assessments. What is important for us to know and how we can protect ourselves? Let's make it simple. This disease is not going to disappear as tomorrow. So we need to learn how we can live with it by having very simple measures, like washing our hands frequently, like covering our cough by blending our elbow or covering with a tissue, by avoiding crowded places like offices, markets, elevators, and other places that can be source of mass gathering. We need to follow the physical distancing measures, reminding ourselves that at least we need to keep 1 meter distance between us and others. We need to avoid touching our faces as much as possible. And if you are sick or if you feel unwell, please stay at home. Protect yourself and protect others. And seek medical advice. Call early. Call your family doctor, your physician. Call before you go to the health facility. And stay aware of the latest information. And for this, I want you to take 3 messages with you. When you are searching for information, make sure that you are looking at a credible source. Be curious and be critical. Make sure that you don't share or amplify information which is not correct. Last but not least, be positive in the way how you take this information and be the change you want to see and lead by example. I have been asked a lot about masks, and I want you to take also 2 main messages with you about masks. First, surgical masks, or what we call medical masks. Medical masks are for health providers taking care and providing health care for cases, or for people who are taking care at home of sick people, or for sick people with COVID. So medical masks or surgical masks are for these three types of people and family members around us. In addition to, medical masks are for people who are 60 or over of age, or people who have underlying conditions and vulnerable, who have low immunity, who should wear medical masks in situations where physical distancing is not possible. For the general public, they can wear a fabric mask where there is widespread transmission and physical distancing measures are difficult, such as in public transport or other confined or crowded environments. I have been asked a lot about fabric masks. And for fabric masks, WHO have been recommending to have it in 3 layers. The first inner layer to be from an absorbable material like cotton, and the outside material to be from unabsorbable material like polystyrene or other material that are not absorbing. And how to wear mask, especially, and here for the fabric masks. As you see, here are very simple measures which we can all follow. Wash your hands thoroughly before you put more masks on. Make sure that you are wearing a clean mask. Put it on properly. Make sure that it's covering your mouth and nose, and avoid touching your mask. And make sure that you clean your hands. And when you remove it from the strips without touching it. And make sure that you are saving it in a way that it protect it from becoming dirty. And when you wash it with water and soap. And of course, clean your hands after taking it off. And make sure that when you are wearing a mask, that you can't share it with others. So it's your personal item. And make sure that it is covering your face properly, and it's covering your face in a way that it's also tight, but not tight in a way that prevents you from breathing or talking. But what I mean tight, that it's basically sitting on your face properly, covering your face properly. But masks alone will not protect you. So masks is a measure of other measures that you need to follow to protect yourself and protect others, like washing your hands and keeping physical distance from others at least 1 meter. When you are using public transportation or moving around, there are precautions that you have to follow, like for example, covering your mouth or your and nose when coughing, and when using these crowded means of transportation, make sure that you are using a fabric mask. What is more feasible and more recommended as much as possible, and consider walking or using a bicycle to your work or to the destination where you are planning to go. To protect yourself and others, you need to talk to people you trust. We are in an unprecedented crisis that can affect our mental health. It is normal to worry. It is normal to feel the pressure on your chest and shoulder. But also, you need to equip yourself with the skills that can take you out of this and make you helpful for yourself first and for your community. Identifying your social network, talking to your family, talking to your colleagues, talking to your people in the community who also depend on you. You need to support each other. Solidarity is the key word to go over and go forward through this crisis. Show compassion, avoid stigma. And why we need to avoid stigma? Studies have shown that stigma increased, made people avoiding medical care and avoiding testing, which basically will increase the people who have the disease in the community and not receiving the medical attention they deserve and need, and also increasing the risk of having other people infected. For people who were infected with COVID, it wasn't their mistake. So please remember, they are part of our community. They are either a part of our family, or they are a health provider who worked hard to save us and save others, or people who are basically simply doing their job, but they encountered the disease. Remember that health workers and frontline workers, like policemen and others who are working around the clock to serve us and support us, they deserve your respect and gratitude. In many countries around the globe, we saw people saluting health workers. And I want to take this opportunity while talking to you, to remind you and to ask you to be thankful to the health provider in your community, in your city, in your country, and around the globe. And for you, as an active person in the community, you need to know where to seek help for physical and mental health. For this, you need to keep up your contact details of the doctors, of the family doctors, of the clinics, of the ambulances, and the hotline in your country, displayed in a clear and approachable and accessible place in your house, so you can approach them whenever needed. Avoid rumors and seek credible information. One of the main enemies in this crisis was the infodemic. Why? Because it increased the anxiety, it increased the stress, it made people more worried. So please, when you are sharing information, make sure before sharing or clicking, as we are all using the social media, make sure that you are sharing credible, correct information, and you are seeking information from a credible source. You have the WHO as a source of information. You have the websites of your ministries and national authorities as a source of information. Please go to these websites to seek credible source of information. And amplify and be the share hopeful stories. Be the person to spread positive energy and positive stories to help that will help others and will be the source of change. Last advice, spend less time online. Limit the time that you are just online to follow the crisis. Use your time to be with your family, to do the things you love, to exercise, to be involved in random acts of kindness, do your hobbies. I have been talking to many of my colleagues and friends, and they told me that during this crisis, it helped them to read more books. So maybe this is something you may consider. Me, myself, I painted more, and one of my paintings you can see in the background. This photo is the photo of my father, the person who made me the person who I am today, who helped me, and with him helping me and guiding me, I was able to help others. My father was the change he wanted to see, and he led by example. And in this photo is Adam, my nephew, the youngest boy in our family. And as you see, they are greeting each other by elbow. So we can still greet each other without hugging and shaking hands, and follow my dear father and Adam example of how you greet each other. And also I have some advices for you to be part of your community and to contribute to the change you want to see. COVID crisis will be over. I can't tell you, I don't have a crystal ball to tell you when it will be over. But I know for sure, if we work together, we will make it. And to do so, we need to help ourselves and help others. COVID is not one and the only program that WHO is working on. And in this slide, I'm sharing with you an opportunity to contribute to the European program of work. We want to hear from you, and you can have your valuable contribution to the United Action for Better Health and help in building the future of health in Europe. My regional director, Dr. Hans Kluge, said, by contributing to this consultation, your replies will be invaluable in mapping our collective journey in the months and years ahead, delivering health and well-being to the people of Europe. And this is not only the way that you can contribute. In addition to contributing to the European program of work, which basically providing a roadmap for building a better future of health, you can also contribute to a global act where your contribution counts. The United Nations is making its 75th anniversary at the time of this great challenge and the worst global crisis in its history. And with this link, I'm seeking your support to have 1 minute of your time to participate in this 1 minute survey where your views will be reflected in the Security General Report at the UN Summit in September and would inform the shaping of the UN priorities of global collaboration. Solidarity means a lot. Solidarity means your contribution to your community and also your contribution to the global community. And you can do so by also sparing 1 minute of your time to contribute and complete the survey. Last but not least, there are a number of links that you can access to learn more about how you can protect yourself and also some advices for travel. And you can also learn more about COVID in Kyrgyzstan at covid.kg. Before questions, this is one of also my favorite photos. I took this photo during the World Nomad Games. And I keep looking at this photo because it inspires me. For a country which hosted World Nomad Games, gathering athletes and people from around the globe to enjoy and to honor traditional sports, this country and all countries in Central Asia will manage to overcome this challenge. The country of mountains, these countries where the mountains have seen and witnessed many incidents and many actions across history. Together, we can overcome this. With the support of our great ladies, great mothers, great health providers, great fathers, and great colleagues, we will make it. Thank you. Spasiba. Kimberly, over to you.
Thank you very much for sharing all those insights with us. It's definitely very useful. So we do have a couple questions on the question and answer form, and I encourage anyone else who has questions to type in their questions now so we can discuss these things. So one question that we received was, if someone is infected and has since recovered, how can that person be reinfected? I know this may be something that's still uncertain, but maybe to expand that further, how would you, what can you say to suggest how they can prevent themselves from being reinfected if it's unclear at this time?
Thank you for the question, because this is one of also the common questions that I receive usually. And to answer this, we have 3 aspects to cover. First, we are talking about a new virus and a new disease, and we learn every day. My dear colleague, Dr. Linda, have been saying, and I'm here quoting her, that when we are looking at a CT scan, every section in this CT will give us, in this scan, will give us a picture for the diagnosis. However, we can't make the diagnosis unless we look at all the pictures together, at all the scans together. And in this crisis, every day is providing us with one more slide or picture, and we learn more about this disease. So studies, scientists have been studying around the clock to learn more about this disease and this virus. But what do I need to know? How I can protect myself? And again, I will go to the simple measures, which will take me to the second aspect of answering this question. Washing your hands, keeping physical distance, and ensuring that you have access to credible information of how to access healthcare. And last but not least, please, and this is my third part, would be my third and last part of answering this question. Remember, stigma. We shouldn't stigmatize people with COVID. Stigma can increase the spread of the disease in the community. Stigma can cause another crisis because it can delay or burden the response in your country. So to make it simple, protect yourself and protect others. For people who recovered from COVID, they are an example with us who are basically also need to take further cautious in protecting themselves.
Thank you. So another question we had was, they say the virus is not alive. How is it multiplying and mutating? It seems to have a mind of its own. So do you have any comments on that?
Okay. I said in one of my first few slides about coronaviruses, and this is not the first time we are experiencing coronavirus. So COVID is from the family of coronaviruses. So COVID-19 is the newly discovered virus from coronaviruses. And in history, we know MERS and other types of coronaviruses which caused also other outbreaks. So for this new virus, which have been in a way suspending our normal day-to-day lives, in answering this question, I want to say two messages. First, we need to know how to live with it. We are not all scientists, we are not all health workers to understand the genetic components of this virus. But what I need to know is how I can live with it. Not only by protecting myself, but also of how taking my life forward. And this will take me to the second part of my answer. Many of us are teleworking. Many of us suspended their plans and beautiful plans for travel or for gathering, for weddings, for celebrations. But maybe there is a positive side of this, of suspending these activities. Like for example, today we are having this lecture. In normal situation, I will be in the university campus, enjoying the beautiful nature, enjoying looking at my colleagues at the university, inspired also by the positive energy of the distinguished students of the university. But today I'm doing it online, where I can reach out to many of you, where also my family, my colleagues, and others can attend this. So please, look at the positive side. Maybe we canceled many of the celebrations and the mass gathering. Maybe our mosques are closed, our churches are closed, but we still can make the change. Be the change you want to see. You can pray at home, you can celebrate with your family and friends online, and you can still share the love and care you want. And for this virus, there are more and more we can learn every day.
Thank you. And so I guess going off of that on, connecting with your family and friends online, what would you say is like some top tips for someone who may be experiencing some mental health problems, whether it be a struggle within their family or something personal? Do you have any specific advice that you can give?
I will share with you my experience. So in my work, I have to, in my work, I have to support 5 countries. I used to have regular missions to my 5 countries in Central Asia. And when this crisis started, I was not able to visit my other countries. I was not able to go to my beloved Tajikistan, Uzbekistan, Kazakhstan, Turkmenistan. I had to stay in Kyrgyzstan. I was feeling that I have huge amount of work. And I had to face it because others depend on me. And also I need to find the strength from inside. My father helped me with a golden advice. Baba told me that work will never finish. Every day you will have more and more and more tasks to do. So talking to my father, expressing my challenge, sharing my stress, helped me to receive this golden advice. His advice was like the golden word in my mind every day. Work will never finish. We all have tasks, we all have pressures, we all have commitments that we need to meet. And with this COVID crisis, our movement is restricted, our interaction with people is limited. However, we need to prioritize. We need what we can, we need to be honest, what we can do, and we can do one step at a time. What helped me also, reading, painting, talking to my friends, and cooking. And whenever I need advice, I approached my colleagues, I approached my friends, I approached my family, I approached my network, and who I call them my security net. And I exercised more. I started after the quarantine was over in Bishkek, I started to walk more. So exercising also helped me. My personal experience is not only, is not the only way how I want to advise how to overcome this, because this crisis has a lot of impact, not only on us, but also on our children. And many of the audience today, they have children. And we as parents also have commitment. So for your children, my advice would be, engage them, explain to them in a simple way, and also teach them simple measures of how to protect themselves. My little niece, Hannah, every day when anybody of her uncles or my sisters and my brothers are coming to home, she immediately runs to them with a sanitizer, asking them to clean their hands. And this is a simple way because she saw how the other family members are interacting. Also, you can do the same with your children. You can, I know I was asked 3 days ago about children wearing masks and how it's difficult to make them wear masks. So for children, first of all, avoid putting them in crowded places. And if you have to do so, and you have to ask them to put on masks, engage them in making their own fabric mask. Engage them in decorating it. Engage them in buying and selecting it. So by engaging them and by giving them other skills, they can also overcome this crisis. They are our future and they are our today. And as they are experiencing this challenge, by helping them, we will also get the positive and the innocent energy from them to be able to go through this together. And also the elderly, our grandparents. Many of us have been advised not to visit our grandparents during this crisis, to protect them. But still you can be engaged with them. You can call them. You can have Skype, Zoom meeting, and using these social media channels to be connected with them. Share the love and the passion and the care. Last but not least, remember, the way to go over this is solidarity. Everyone is responsible, and everyone should be part of this solution and should be part of this change to go through this crisis. Tomorrow we will be more stronger. Tomorrow we will have more clarity. Tomorrow we will have a better picture about this disease. And to reach tomorrow, we need to go over today with positive spirit, with energy that we can make it.
Great, thank you very much for the comprehensive response. It's definitely important to work together to try to find a solution on how we can all stay healthy. Another question we received is, what kinds of food are needed to, or what kinds of food can help you boost your immune system? Are there any recommendations that WHO has put out, I guess, in terms of this regard?
I will start with the golden advice when it comes to food and nutrition. Make sure that your food is healthy, but how we can define healthy. So healthy is the food, first of all, it needs to be something you like, something that is coming from your environment. So, especially that we are in Central Asia and in the season of the beautiful fruits and vegetables. You can get a lot of vitamins from having more portions, at least 3 portions of the seasonal fruits available and accessible. In addition to, it is more important to understand that nutrition is part of your healthy lifestyle. So eating less carbohydrate, less fat, focusing on also drinking fluids, avoiding unhealthy practices. All these issues are important. And to boost your immunity, it is really also important to have vitamins, especially vitamin C, and please drink a lot of water and fluids.
Thank you very much. So I guess another question was regarding, and it may be a little bit out of the WHO purview, but it's asking about how certain countries are having lockdowns and other countries are not. That person has commented that, you know, death rates are not that great, as we all know from the statistics you've shared. So I guess, is having these lockdowns enforced everywhere something that WHO is promoting, or is there something that, I guess, what are your thoughts on this lockdown concept?
Countries are implementing different public health measures. And when they are implementing these measures, they are taking into account different factors. WHO is providing technical guidance, is providing guidelines, and one of these, for example, is the guideline of how to have staged transition from lockdown to opening the community. And every day we are seeing like countries would adopt different measures. What does this mean for us? Countries, when they are taking these decisions, they are basing it according to the status, they are taking into account the epidemiological situation, they are taking into account the capacity of their health system, they are taking into account also their economic situation, and accordingly are implementing the different measures that are essential and crucial to protect and help their people and their community. In Kyrgyzstan, for example, we have been in lockdown a few weeks ago, and after it was lifted, it was done on a staged approach where some economical activities were allowed first, and then gradually others were allowed later, where it basically also helped people to look again into helping the economy. In other countries, they also started looking into allowing or making possible some domestic flights before opening their borders and the international flights. So for us, and especially as we have many of our audience are from the academic institutions and students, I would say if you allow me, I want to share some advices of how we can be more productive and how we can be supportive, regardless of the country where we are, especially that maybe some of us are in a country putting some lockdown measures or in country where there is a partial lockdown. Well, how I can be productive? First of all, many of our classes have been suspended. And maybe we don't have the interaction with our colleagues as we use daily, especially for us when we are in academic institutions, we want to enjoy the facilities. Nevertheless, use this opportunity to still be active in your community. Be involved in simple acts of kindness. Organize groups and discussions that are productive. Approach your tutors, approach your mentors. Make this as a productive time to read more, to enjoy your hobby. Maybe you can't have your class on a face-to-face interaction, but you are the generation of the technology. You are the generation of digitalization. So use this opportunity to use these channels to be connected, to advance your education, to read more. And again, as you are part of an academic institution, you have an important role to serve your community and support your community by being a part of spreading the correct and credible information, and also by being maybe involved in a kind of a research on an assessment with the help of your supervisors and teachers. Last but not least, to remember to be grateful and thankful for health workers and the frontline people in our community who are working day and night to protect us and keep us safe.
Thank you. And I think having this platform of this lecture is very useful to get the real information. As you said, we need to find the proper sources. So we definitely appreciate that. We have another question on someone asking for advice if you're traveling, specifically elderly people. Do you have any advice on that?
Before we travel, there are some things that we need to have on our checklist. First, ask yourself, do I really need to make this trip? Keep your trips only to essential travels that you need to make. And then for the place you are going, make sure that you have all the information you need, how you can access medical care in the place you are going to, health insurance you need. Maybe you have to take your drugs with you. You have to take your prescriptions with you. So make sure that you are well equipped with all the information you need to know about healthcare services to the destination you are going to. And when you are traveling, make sure that you are protecting yourself by washing your hands, keeping your hand sanitizers, having your masks, and follow the guidelines and the recommendations that are provided at the airport or by the airline company that you are using. And at the destination, when you arrive, follow the instruction. Many countries are recommending, and the practice is to have 14 days quarantine upon arrival. Please follow the instruction of the authority of your destination and make sure that you follow these guidelines. So to simplify it, if you want to travel, limit it only to essential travels. During travel, protect yourself and make sure that you follow the guidelines and the information provided at the airport and by the airlines. And third, in your destination, follow the guidelines and the instruction of the country you are traveling to.
Yes, it's definitely a a weary time to be traveling, I guess. So another question was regards to how the virus can be spread. So the person mentioned about mosquitoes, but I was also wondering, do people have to worry about their pets potentially transferring this virus? Is this something maybe we don't know the research yet, but are there any, is there any information you can share on that?
According to up-to-date information, this disease spread by droplets. And that's why we keep saying, to protect yourself, you need to keep washing your hands, not touching dirty surfaces. If you have to do so, make sure that you keep your hands clean. Simple measures. Avoid crowded places, avoid mass gathering, and if you are obliged to be in a place where you can't keep the 1 meter distance, wear your fabric mask, and make sure that you are protecting yourself. So this disease is basically transmitting by droplets. So to protect yourself also and protect others, there are also what we call the coughing etiquette. So when you are coughing, cover your face with your elbow or with a tissue, and then make sure that also you wash your hands. If somebody is counting how many times I repeated, wash your hands during this, this session, it is only because how it's really important to keep washing our hands as a way to protect ourselves. We keep learning about this virus. We keep learning about the mode of transmission, and we need to follow the guidance of our health providers and keep protecting ourselves. If you allow me, Kimberly, I want to maybe share a final advice with our audience. Especially that when we were discussing this session, we were talking about stressing on main messages that will help our listeners to improve their well-being and mental health. Remember that there are many things under your control. And what is under your control is to keep yourself protected, is to help yourself and help others. And there are things that you can influence. What you can influence is your community, your surroundings, and the people who you are committed to help and live with, like your colleagues at work, your family, your friends, and you can lead by example. Last but not least, there are things that are outside your control. Don't make the things that are outside your control make you more anxious. Remember that the more you have access and clarity to clear, credible information, the more you will feel better. So uncertainty in this crisis made us anxious and worried. And to go over this, make sure that you search for information from credible sources. Go to WHO website. Information are available in different languages, in English, in Russian, and in the country website, sometimes the material is also available in local languages like Uzbek, Tajik, or Kyrgyz, or Kazakh. Last but not least, and I want to repeat this again and again, and I want to use this platform to say thank you. Thank you to all health workers. Thank you to all health providers. Thank you to all frontline workers who are working to protect us. Dear colleagues, dear friends who are listening to me, many of the health providers who are working hard to protect us have been also infected with COVID, have been away of their families, have been away of their children. And the least what we can do is to show respect, to show gratitude, to say thank you. And I want to end this by thanking you, by thanking the university for giving me this opportunity, and say how much really I'm honored and grateful to be part of this forum today.
Thank you very much for your time and your insights and knowledge that you've shared with us today. Actually, we have completed also all the questions, so I guess it's good timing. So as the Dr. Atatrah said, keep learning, and we hope that you have a good rest of your day. And thank you again for joining us today.